Hello, and welcome to a brief discussion on pathology of the elbow and distal humerus. Before we get started, let's review some terms that we should be familiar with. So bursae is plural for bursa, and a bursa is a fluid-filled sac that lies in between tendons and joints. And remember, tendons are these fibrous cords that attach muscle to bone. So the bursa lie in between those tendons and bones. Ligaments, remember, are fibrous bands that hold bones together, particularly in the region of a joint. So tendons attach muscle to bone, ligaments attach bone to bone. Okay, bursitis is the inflammation of the bursae, or the fluid-filled sacs that enclose or surround the joints. The process of bursitis generally involves the formation of calcification in those associated tendons, and that calcification causes pain and limited joint movement. So, to recap, a bursa is a sac made up of thin, slippery tissue in between the tendons and the bones. It's found in the body wherever skin, muscles, or tendons need to slide over that bone, so in movement. Symptoms include pain, limitation of joint movement or range of motion, and swelling. So olecranon bursitis is a specific bursitis related to the upper extremity that we're studying now. So olecranon bursitis refers to the inflammation of the bursa located at the tip of the elbow near that olecranon process. And you can see significant swelling here, of course redness, and you can imagine that this is very painful when the patient tries to move their arm, or move that elbow joint. Okay, tendinitis and bursitis are two common conditions that we see affecting young people and old people. And again, it occurs around those joints, specifically the more active you are, excessive activity related to sports or exercise, you may see these type of ailments. So remember, itis is always going to refer to inflammation or infection. So in this case, tendinitis would refer to the inflammation of the tendons, bursitis, the inflammation of the bursa. Okay, new term for us, joint effusion. So a joint effusion is an accumulation of fluid in the joint cavity. And the fluid could be synovial, so excess synovial fluid, or it could be hemorrhagic in nature, so a bloody type fluid. A joint effusion is a sign of an underlying condition, such as a fracture that's not obvious on X-ray, a dislocation, soft tissue injury, or even inflammation. Okay, so in this case, a joint effusion makes itself present when you see excellent or perfect positioning and the presence of the fat pads. So a joint effusion could cause inflammation or excess synovial fluid, which is going to elevate the fat pads and make them visible. Okay, so accumulation of fluid in the joint. I just wanted to give you an idea of where the synovial sacs lie in the elbow. So this is our anterior projection here, and so you can see this large synovial sac in front of the elbow, and then a synovial sac behind the elbow in the posterior view. And again, imagine if you have an injury to that joint, which causes inflammation and excess synovial fluid, you can see how that may cause the fat pad to be elevated. The joint effusion kind of pushes that fat pad up and makes it visible. So if this is an elbow and this is the front and this is the back, can you tell me which elbow this is, right or left? Good. If you said a left elbow, you are correct. Good job. Next, let's talk about osteopetrosis. So I don't need you to know much about this pathology other than it means abnormally dense bone. And this is actually a hereditary disease, again marked by abnormally dense bone, and it can be seen in various parts throughout the body. You don't need to write this down, but it commonly occurs as a result of a fracture of the affected bone, and it could lead to the total deterioration of the bone marrow space in that bone. This condition is also known as marble bone. So you can see here in the skull, this area would be osteopetrosis. It's abnormally dense. You can see it's very white and thick looking compared to the rest of the skull. And here, certainly in the joint of the elbow, you can see abnormally dense bone. Okay, osteopetrosis. Next, let's discuss a couple malignant bone tumors that you may see in the upper extremity. The first one we'll discuss is multiple myeloma. That is the most common primary cancerous bone tumor. And by primary, we mean that it has not metastasized or spread from anywhere else in the body. Multiple myeloma generally affects people between the ages of 40 and 70. And as the name implies, these tumors occur in various parts of the body and actually arise from the bone marrow or the marrow plasma cells. They are highly malignant and usually fatal within a few years, unfortunately. The typical radiographic appearance includes multiple punched out or osteolytic lesions, and by osteolytic we mean destructive. They're taking away from bone density. And these lesions can be scattered throughout the affected bone. And here you see an example affecting the distal humerus. Another type of bone malignancy that I'd like you to be familiar with is osteosarcoma. And an osteosarcoma is another example of a primary cancerous bone tumor, again meaning it did not metastasize from somewhere else, it originated in the bone. Osteosarcomas typically affect younger people between 10 and 20 years of age, but it can affect anyone at any age. And it may develop in older people actually with a history of Paget's disease. So what I'd like you to remember is anytime you see the word sarcoma, that is going to refer to a malignancy, and osteo, of course, referring to the bone. So multiple myeloma and osteosarcoma would be examples of primary bone malignancies. Okay, enchondromas. Now this is a type of bone tumor that is actually benign. So enchondromas are slow-growing, benign, cartilaginous tumors. So again, that term cartilaginous, remember it's probably originating from the cartilage. They are most often found in the small bones of the hands and the feet, particularly in adolescents or young adults. Enchondromas typically arise near the region of the growth plates. And remember, growth plates are cartilaginous before they ossify. Generally, enchondromas are well defined, meaning they have a defined border. They're radiolucent, and they have a thin cortex or edge that can often lead to pathological fractures with only minimal trauma. So let's take a look at this in the fifth metacarpal here. You can see this is the enchondroma, again arising from the region of the growth plate that was cartilage before it ossified into bone. You can see it's got a very thin cortex, and you can imagine that a very slight trauma to this region could cause a fracture in that bone. Okay, so enchondromas, remember chondro referring to cartilage, enchondromas are benign. Another benign bone tumor is osteochondroma, and this is actually the most common type of benign bone tumor, usually occurring in people between the ages of 10 and 20. Osteochondromas arise from the outer cortex of the bone, and the most common site for this is the knee, which you can see here. This is an example of the posterior tibia. But they can occur in the pelvis and the scapula are other examples, particularly in children or young adults. So please remember that osteochondroma and enchondroma are two benign bone tumors. typically found in young people. Okay. Next, let's talk briefly about elbow dislocations. Dislocations of the elbow can occur with trauma. And with a dislocation, there's typically no fracture. I mean, there can be a fracture, but typically there's no fracture. And what happens with a dislocation is the bone is pulled out of the joint space. The sooner the joint is reduced or fixed, or the sooner the bone is put back into place, the better the prognosis. I want to introduce you to a type of dislocation called a nursemaid's elbow. A nursemaid's elbow is a common injury of early childhood, and it's sometimes referred to as pulled elbow because it occurs when a child's elbow is pulled and then partially dislocates. By the way, the term for a partial dislocation is called a subluxation. Subluxation. Now, let me paint a scenario for you. Let's say you have a toddler who's running into the street and you grab their arm to try to stop them. Just that simple grabbing and pulling could cause their elbow joint to dislocate. Okay, so that's why the term is nursemaid's elbow. It's, think of a caregiver trying to care for that young toddler, accidentally pulls their arm too hard and dislocates their elbow. Generally, with nursemaid's elbow, a slight manipulation of the elbow joint, such as positioning for an x-ray, can reduce or put the elbow back into place. So just simple, moving of the arm can cause that joint to reduce. And when we say reduce, we mean the bones are put back into place. Okay, so please be familiar with nursemaid's elbow. Okay. Last slide, you guys. Let's think critically. Let's think outside of the box. This young person has a severe right supracondylar humerus fracture. So supra meaning above the condyle, and they actually have complete displacement of the fracture fragments. And you can see that here. The fragments are completely displaced from the humerus. So how would you obtain a lateral projection on this child? Because we know the AP, you can simply, gently lift this arm, slide your image receptor underneath, and obtain a nice AP. But how would you get a lateral as you see here? Well, you're going to put a couple towels or something, a blanket underneath this arm to build it up. You're going to put your image receptor perpendicular right here, setting on the cart or the table, and then your central ray is going to come in this way. And you're going to shoot what is called a cross-table lateral. And we've talked about that in lab before. So in this case, you would not move the arm or bend the elbow to obtain a lateral. You would simply do a cross-table projection. And that, again, is what you see here. Okay, great. If you have any questions about pathology, please don't hesitate to reach out, and thank you for listening.